Embolization of hemorrhoid is a recently introduced minimally invasive image-guided procedure for treatment of internal hemorrhoid in patients with symptomatic bleeds. This animation demonstrates how this minimally invasive procedure is performed step by step through the right groin access in angiogram suite. As the first step, skin in the right groin area is marked based the upper and lower margins of the right femoral head. Once the location of the common femoral artery for access is picked up under ultrasound, the skin entry site is numbed by injecting lidocaine. Then, the right common femoral artery is accessed under ultrasound guidance using a micropuncture needle. Once the blood return is noted, a microwire is advanced through the needle into the right common femoral artery. Subsequently, the needle is exchanged for a transitional sheath, and the transitional sheath is advanced over the microwire. The microwire and inner dilator of the transitional sheath are exchanged for a wire with larger diameter and longer length, which is advanced through the transitional sheath into the aorta. Then, the outer layer of transitional sheath is exchanged for a vascular sheath. The dilator of the vascular sheath is removed. At this point, the sheath is aspirated and flushed with heparinized normal saline. Contrast may be injected to assess the patency of the common femoral artery and safety of the access. Subsequently, infusion of normal saline is started through the sheath to avoid possible clot formation at the tip of the sheath. A curved catheter is advanced over the wire through the sheath into the lower aorta, and subsequently the curved tip of the catheter is formed by pulling back the wire. Then, the wire is re-advanced for 1 cm out of the tip of the catheter. This combination is used to select the inferior mesenteric artery. Subsequently, the wire is exchanged for a combination of microcatheter and microwire. This combination is advanced through the curved catheter to select the superior rectal artery contributing to the hemorrhoid. Once the tip of the microcatheter is placed close to the hemorrhoid, the microwire is removed and embolization of the hemorrhoid is initiated using small particles in pulsal fashion. Multiple injections of particles may be required. The particle embolization is continued until the blood flow is slowed down and the hemorrhoid space is filled with particles. As the final step, the target artery is proximally embolized using pushable or detachable coils pending on the interventionist's preference to mechanically block the supplying artery. Upon completion of the embolization, the catheters are removed. Hemostasis is achieved either by applying manual pressure or a closure device. For active closure device, first a short wire is advanced through the sheath into the common femoral artery. Then, the vascular sheath is removed and a special sheath and dilator provided in the closure kit is advanced over the wire into the common femoral artery. After adjusting the position of the sheath's tip based on the bleeding feedback from the back end of the sheath, the dilator and wire are removed. The collagen plug carrying component is assembled and advanced into the sheath. After attaching and clicking the last part, the whole sheath is pulled out until resistance is felt. After feeling resistance, the middle plastic piece is pushed back over the string into the tract till the collagen is packed in the outside of the common femoral artery. Then, the string is cut by scissor in the middle part. And after removing the middle plastic piece, the rest of string is trimmed at the level of skin.